name is Toby. I'll be your student nurse administering your medication. So I'm just doing my safety check, making sure there's nothing on the floor. And can you tell me your name? Paris Maris, okay? And your date of birth? Okay, thank you very much. So while I'm here, I'm just gonna make sure that the site looks good. And I see that there is normal saline already connected here, but it's not running. And normal saline is in the bag, which is patent as well. So next, I am going to do my first check with what I have here. So right patient, Paris Mercy. Paris Mercy, can you state your name for me? Paris Mercy. Right jug is morphine. We have an order for morphine. Right dose is 1 milligram. Right route, this is going IV. And right time, it's 10:30 and it's due now. And right reason, the patient has severe pain. Right education, so you are receiving morphine because of pain. And I know the patient has a right to refuse this medication as well. So after I've done my first check, I'm just gonna check the tube. So this is the right tube for PCA. And so there's no port, and it is primed, but I'm going to double check, and the setting is right, so it's already there. So now I am going to turn on this, and I'm going to check the back for the code 9462. Okay. Okay. So I'm just going to let that run. Program, yes. Yes. So the code, I'm just going to put the code. Okay, so now, yes, units is in milligram, we have milligrams, so yes. Concentration, milligram per mil, we have one, yes, and this is going IV. And low dose, there is no low dose here, so yes. And main limit off. And next, yes. Bag volume, total bag volume is 50 mils, so yes. Basal rate is, there is no basal rate, so 0, yes. And patient bolus is 1 milligram, so 1 milligram, yes. And the time, 5 minutes. So 5 minutes, yes. And the bolus per hour, so 60 divided by 5 gets 12. Yes. So done, yes. And then I'm going to press no to review. So no to review. So yes, milligrams, yes. Concentration 1 milligram per mil, yes. This is going IV. And low dose, there is no low dose. And med limit is off. And next, yes. Bag volume is total of 50 mils, so yes. Basal rate, there is no basal rate. Patient bolus is 1 milligram. Bolus interval 5 minutes, and bolus per hour is 12. So done, yes. So I'm going to complete my second check. So right patient, Paris Mercy, can you state your name? Paris Mercy, Paris Mercy. I'll have Paris Mercy. Right drug, we have morphine, and right dose is 1 milligram. We put in 1 milligram here. This is 1 milligram. And right route is going IV. Right time is 10:30 and it's due now. Right reason, patient has severe pain. And I also know the patient has a right to refuse this medication. And I already educated the patient that this medication is for pain. So after I've done my second check, I'll call the nurse to do the third check. So she will do the third check with the bag, the pump, the order, and the patient's wristband. So now after I've done the 3 checks, I am going to prime the tubing. So run to start, no to review, now press prime. So I'm going to prime this, press hold to prime. So until I see the bubble come up. Okay, so the bubble came up now. So next, now I have primed, so I will go ahead and attach to the patient. So I already clamped this. So I'm going to take this out. Okay, ensure to maintain sterility. And try not to touch the tip of anything here. So I'm gonna leave that first, and I'll cover that with a cap, just so I don't touch it.
So there's two boards there, and then it should have been.
So I'm gonna cover this, okay? Oops. And I'll leave this here. So now I would attach this. I will clean that first. Losing this a little bit, okay? So now I will attach this here. Clean for 30 seconds, leave to dry for 15. Take this off, and now I can now directly attach. So after I've attached then I will alcohol swab this part. Again, take another alcohol swab. So I'm just gonna silence this. So now I will alcohol swab this. 10 seconds, leave to dry for 15. And then take this, just take this out. Now I can now attach it here. Okay, so now I would open this and I would set the rate here. Press primary, and then ml per hour. This will go for 20 ml per hour just to keep the vein open. And the bag volume we have here is 1000, so I'll put 1000. And then it's already connected. Make sure it's open, and then I'll press start here. Confirm primary, press start. And then I will come here and I'll press press pause and select. Okay, press pause and then go up, repeat, yes, to maintain current schedule. So we just go over this 1 milligram IV 0. Next, yes, 50 mils, basal 0, patient bolus 1, 5 minutes 12, done, yes. So now I have done everything, primed, and it's already connected, so I'll press run. So while I press run, I'm going to watch out for the beeps. So it's beeping, that means it's actually flowing. And then also I would educate the patient about this So I'm gonna let them know that they are the only ones that can press it, and they will hear a beep. Not even the nurse can press it. So for the sake of this video, I'm just gonna demonstrate how to. So when you press it, you are going to hear that 2 beep, and then if you press 5, you will see this, and you will see. So the patient has requested 1 but has gotten just 0. So now leave this here. So I'll do my exit safety check, and I'll go ahead and document this medication. And for morphine, I'm going to have my Narcan ready just in case they go into adverse reaction. So next, I am going to do my chest tube dressing. So the patient is still comfortable in a safe position. So I'm putting them in a semi-fowler. They're already in a semi-fowler position. So I'm just gonna check the site, if that's okay. I'm gonna raise their hands up. Okay, so I'll wear my gloves.
I'm gonna look at, I'm gonna mark where there's a line with initial.
So the side looks dry and intact. I'm feeling for crepitus. There is no crepitus. I checked the tube. Okay, there is no kink, there is no clamp, there's no clots. So, and it's coming from here to the drainage system. And I'm going to note the color, the amount, and the I'm going to mark it at the start of my shift. Ensure that this is lower than the patient. I'm going to check the air leak meter. If it's bubbling, that means there's air leak, but it's not bubbling. So if it's bubbling, I would take the clamp and I'll clamp close to the patient. If there is no bubbling, I know that it's here, but if there is bubbling, I'm going to clamp here. just, and then if it stops, I know that it's the air leak is within this, and if it does not, then I'll continue like that to figure out where the air leak is coming from. So next I have my suction. I see the orange ball is visible, and it's at 20 cc water. So, and this is also going to the suction. I'll make sure it's a low suction. So before that, I'm gonna make sure we have our clamp here, and we also have sterile water. And we also have sterile water. So I'm going to go over to the other side and make sure it's set at low suction. So this is coming from the chest tube, and it's set at low suction. So that's good. So next I will go ahead and open my
10
dressing.
minutes left.
10 minutes, okay. So I'm going to go ahead and open my dressing tray and do my dressing.
Your date of birth? So you already know about everything?
So the patient does not need any analgesic, so I'm just gonna leave that here, leave this here as well. So take my dressing tray here. So before I open, I'm just going to open all my supplies that I need. So open this, open this, open this, and then open this. So I'm just gonna take this out, pass it to myself, and leave this here. And I will do my hand hygiene. Oh, that fell. So I'll do my hand hygiene. So, and then I'm going to open all my supplies. So just push that here. Open my, ensure to maintain the 1-inch border.
Got my ID for doing.
Open my jelly next. Just leave the jelly net here. And then my, so I'm gonna pour my normal saline. So now I'm going to wear my gloves and remove the old dressing. So ensure not to cross my field. I'm going to take out the old dressing. Take out the old dressing. I already checked, there is no drainage. I'm gonna quickly take this out. So I'm gonna make sure that it's not dislodging from here. Okay.
So yeah, there's no redness or anything.
Okay.
No drainage. Everything's bad.
So I'm going to assess the site for redness or swelling. There is no redness or swelling. I'm going to dispose this, and then I'll do my hand hygiene again, and then use this, and then make sure to stabilize. I'm gonna take this off, and I'll dispose this in the trash and dispose this as well. So I'll take off my old gloves. So now I'm ready to clean. So I'm gonna take this.
5 minutes.
Okay. Put this in normal saline. So one swipe around and it's dirty. So we throw this in garbage.
2x2s. The dirtiest, the most inner to outer.
Bigger area, one swipe and it's dirty.
So just one full swipe here. Dispose of the garbage.
So make our rosette. Gonna clean the tube, one swipe and it's dirty. So now I will dry,
Swipe.
make the rosette again,
Great. We'll use a bigger one.
one swipe around, dirty, make the rosette again, one swipe in the bigger area and it's dirty, and one more to clean the tube.
Just one swipe on the top.
So one more swipe and it's dirty. So now I'm going to close with the jello net.
Dry it now.
So I'm just gonna wring this out and then use this to occlude this completely. Make sure it is completely occlusive.
Now we're gonna apply the gel net. So
Put the jello net around it. Ensure it is fully occlusive. Okay. And next I would put my
twist it.
so put this here. Okay. Just gonna put this in the opposite direction.
And then I'm gonna put it around slowly. And now once I do that,
You can put this under.
put in my green bottles. So I put one in one direction and the second one in a different direction.
So going in different directions. So now I'm going to put my 4x4 just on top. And then now I would cover with my
Make sure it's sterile. I'm using
Mefix tape. Okay, so ensure not to staple so I don't have to pull this. Go once. Ensure it is fully occlusive, there is no air in it. Take this off. Go up. Okay. And then I already made my label with my name and my designation and the dates. So I'm just going to go ahead and cover this.
So this has to be fully occlusive, and I have to make sure I have to tent it by the tube. So if it gets pulled, it's only pulling on this and not the actual tube.
So, and then I'll take this and then make it tent just so that in case they pull it, it's not pulling on the tube itself. So it's gonna be pulling here instead. And then I'll go ahead and document and put the patient in the position where they would like to be and do my exit safety check, and that's it.